Hello everyone. Okay, so we got chapter 9. We got joints. So we talked about about the skeletal system. Well, muscles. Muscles is next week. And we're gonna get into joints. Okay, we're gonna talk about how those bones are connected and how we're able to get this range of motion or this movement between the bones, and that's all thanks to our joints. Or else we'd be just one stiff connection of bones that can't do anything. Okay, so let's do this. Okay. So we got joint classification. So basically, we got three types, and they're based on the structure of that joint, and they're based on the bones that connect that joint. So depending on the bones, depends on the function, right? So depending on the function, is going to be the structure of the joint, and depending on the structure of the joint, is going to be the name of the joint. So we got three different types. Okay, we got fibrous joints. We got cartilaginous joints or have some cartilage in there, and synovial joints. Okay, so we got this little fluid and different things in the synovial joints. Okay, so fibers, cartilage, and synovial joints. So we're gonna get into each one, and then near the end, we're gonna get into examples, specific examples of each type of joints. Okay, so just take notes of the different joints, names, and some examples of that, and then we'll get into specific examples of each one. So joints have these ligaments. Ligaments are going to be the ones that bind two bones together. Okay, so you think about me as a baseball player. I always have baseball examples. Think about my elbow. To be connected to each other, we got this ligament that's going to be connecting, right? My humerus, my radius, ulna right here. So we got this ligament that's coming here, and that's how a lot of people get Tommy John from flexing too much and extending, and then rubbing that ligament to the bone. Eventually it rips. So we got these ligaments that connect the bones together. Okay, so the first one is fibrous joints. Okay, some examples are sutures, syndesmosis, and interosseous membrane. So sutures, think about a suture, a little like all these lines. Think about the skull, like sutures in between the skull. So we got in between different parts of the cranium. We got syndesmosis and we got interosseous. So interosseous or between bones, a membrane between the bones. Okay, so let's get in the fibrous joints. They have this like fiber connective tissue, like collagen, that will unite those bones, articulating bones. Okay, so let's go. So here's a couple of examples. So here's our sutures. Think of the coronal suture. Between the frontal bone, frontal bone, parietal bone. You have a little suture in there. So there was a suture ligament. So when you're babies, when they're younger, there's a little membrane in between the bones. As they're growing, the suture is less movable or very, very, very small amount of movement, probably earlier. But later on, then it gets stiff, and there's like no movement at all, which is good. We don't want any movement on our cranium between the different bones. Okay, so we got suture between the skulls, and then slight movement in that little suture. Okay, syndesmosis. So here you see the tooth on the bottom. Syndesmosis, they contain more irregular connective tissue than in a suture. So it permits a little bit of movement. So when you think about the bone in our mandible, and you have the teeth that are going to be connected to that bone.
Alondra Hippenstall, please report to the main office.
I'm here to speak.
Alondra Hippenstall, please report to the main office.
So if you think about that, you have these little ligament in between the tooth and the bone that's going to kind of keep it together, hold it together. You don't want it to leave. You don't want it to move. Maybe it moves a little bit. So when you have braces, you're able to move them a little more. It's the point of braces, kind of move them in their spot. But that ligament is going to kind of keep it connected to that bone. And those are the syndesmosis. In this example, in the gums, it's called gomphoses. Okay, between the tooth and the dental alveolus. Okay, so here's a little tooth, dental alveolus. And then the interosseous membrane. So if you see there in between the bones, the tibia and the fibula, there's this little membrane that's in between them. So that's basically a fibrous joint. So there's fibers that are keeping those bones together so they don't just split apart. So they're kind of stay together. Okay, that's syndesmosis. Okay. The interosseous membrane. Let's see. Try not to forget anything. Okay, so those are our fibrous joints. Okay, those are our three. The sutures. Okay, we got the sutures, syndesmosis, symphysis between the teeth and the bones or mandible, and then the interosseous membrane, interosseous ligament that's in there, in between the two bones, in between the bones. Cartilaginous bones. Okay, cartilaginous joints. Sorry, cartilaginous joints. Okay, we have three types or three examples: synchondroses, symphyses, and epiphyseal cartilage. These words are hard to pronounce. I want you to try them. Maybe, but they're just hard to pronounce for me, at least. Okay. So here's our cartilaginous joints. So you have synchondroses, an example here in between the manubrium sternum and our ribs. So it's kind of that little connection in between those two. So we're still able to move a little bit our ribs. If there was no joint there, it would just be stiff. It'd be like no movement on the inside or no. Think about like an accident or some sort of shock in the body. You wouldn't be able to actually press and compress. Imagine just doing chest compressions with just the whole rib cage with no joints. Like you wouldn't get to the heart. Obviously, you have to like find the spot and get like in there. So it allows for a little bit of movement in there, that cartilaginous joints. Okay. There's also some. So those are synchondroses, and then you have the epiphyseal cartilage that's in between two bones. So like inside in here, as you can see. Let me see if maybe I moved it a little more. Yes. So it has hyaline cartilage. I'm just trying not to forget anything. You know? I got my notes in here. Okay, so slightly movable joint. That's our synchondrosis, or here in our chest. And we got our symphyses right here on the bottom. So it's kind of like you have this name, pubic symphysis. So it's like just connection of two right in the middle there. So there's like this little fibrocartilage that's kind of connecting those two bones, the two hip bones. Okay. And the epiphyseal cartilage, so on these growth plates, on the epiphyses of our femur, or the different bones in there. So we got this little growth right here, kind of separating the two. Okay. All right, what else we have? And we have synovial joints. Okay, so that's our third one. So they can be slightly movable. So kind of like if you think about our carpals, so there's a little bit of joints in between this. So just think about anywhere you have a connection between bones, you have a joint in there. Okay, and each one obviously has its function. So we have some that are slightly movable, so we're able to move our hand, we're able to move our fingers a little bit in there, but there's some that have much more movement, kind of like our shoulder, right? So we kind of need to move this a lot more because of baseball or other sports that you can play. So depending on the movement also, we'll give it its structure and we'll give it its function as well. Okay. So here's an example, a structure of a typical synovial joint. Okay, here's our little finger. Coronal section of our finger, kind of cut through our finger. Okay, this whole synovial membrane. What's inside? It's called the articular cavity. So it has this little synovial fluid that's floating in there, so it doesn't get. So it gives it more of a little. They don't have these bone-to-bone kind of connections, and it gives it some sort of soft spot in between those two bones as well. We have this articular cartilage as well at the end of each one. Here's our ligament connecting the two. Okay. And this whole thing would be our articular capsule. Okay. So if you think of here at the right, you see it again more like real life. It's a little articular cavity, cartilage in here, probably have synovial liquid in there, in the middle, synovial fluid in there, synovial membrane. Okay. Here's our bone. Cavity, right? What else? Right. Okay. And then there's also some accessory ligaments, some other discs, some other things that are going to help with those synovial joints that are kind of kind of help the whole movement itself, kind of help protect, give some lubrication, give some space, give some cushion for shock absorption. So imagine every time you jumped, you got bone crushing with bone. And that's why we got a couple of discs in the middle, in between the vertebrae. We have them, the menisci. We have bursae, or little tendon sheets that are also in between connecting, so we don't have these straight up bone to bone rubbing and connection. Okay, typically in a lot of basketball players, their knees, they'll get wasted, you can say, but you have these injuries where there's just like they ran out of that liquid, that ligament, whatever's protecting them, so you have these connection bone to bone, so it hurts a lot. Okay. So those are some of the accessory, bursae, tendon sheets, some nerves, blood supply, things that will help out the joints. Okay. Now we're gonna go into the types of the movements of those joints. So I was reading the other day with my wife, and if you look in the textbook, it explains also how you hear this cracking of people that can crack their fingers. I cracked them already, that I can't crack them again. Oh, there it is. Crack your fingers, your knees, anywhere in the joint. So basically, it's like these gases that are accumulated in between that joint. That once you crack it, you burst those gases, and then it takes a while for them to accumulate again. So that's why you can't crack them like 3 times in a row. Well, some people can, but most of us can't. So like I'm trying, but I can't do it again. And it hurts if you try again. Well, you gotta wait for gases to accumulate in those bones and then crack that gas out. Some people say it's healthy. Some people say it's really not healthy. But I just thought it was a fun fact that you got some gases kind of building up in between those joints in there that you can crack them up and release those gases. Okay, so types of movement in the synovial joints. So we're in the last one, the synovial joints. And there's different ways that there's going to be movement between the joints. Okay, so you got some gliding, so kind of just moving next to each other, kind of just glide across. You got some angular movement, so you're going to move the bones at an angle. You're going to flex, you're going to extend. So those are angles, 90 degrees, less angle, greater angle. Lateral flexion to the outside, hyperextension. I hyperextended my knee. Okay, abduction, adduction, circumduction. We got rotation and special movement. So we got some images of each one of those that you can kind of relate and understand a little more. So here's a little bit of the gliding movements. Synovial joints. Here's our carpals in our hand. So all these little bones in there, they kind of got to move. They're not really going to rotate or move somewhere else. They're just going to be able to glide between each other to give us a little bit of movement in our hands, right? So you grab something, you kind of let them glide, let them move a little bit. So that's gliding between the carpals. Okay. Angular movements. We got here's a guy in his neck. Atlanto-occipital and cervical intervertebral joints. So in our cervix, in our head. So we got these joints where we're able to flex and extend, flex and extend. So reduce the angle, increase the angle. Okay. Think about our shoulder joint. We're able to flex, we're able to extend, flex and extend. Think about our elbow joint. So think about the whole shoulder, and then think about just the elbow itself, the wrist, the hip joints. So these are angular movements. Okay, the knee, intervertebral, so lateral flexion to the sides, our vertebrae. Allow them for that movement. Imagine we were just all stiff and just bones again, so we wouldn't be able to have that range of motion, right? What else do we have? Rotation, medial rotation, so rotate to the middle. So I think I'm getting ahead of myself. Okay. So again, here's an example: adduction, abduction. So adduction is basically towards the midline of the body, and abduction is towards the outside, so away from the midline. So here's our midline. So adduction coming in, abduction going out. Okay. What else we have? Also with our hand, so think our thumb. Adduction is coming in, abduction is going out. Abduction coming in, abduction in, out. With our foot as well. Circumduction, kind of going in a circle. Think of our leg when you move it in and out, in and out. Our hand, you move it in and out, kind of in a circle. We have rotation, kind of rotating along its own axis, just a little bit of rotation, medial rotation and lateral. So medial is if I'm just gonna rotate in, some stretches that we do in baseball, rotate in, medial, rotate out, lateral. Medial, lateral, medial, lateral. Okay. So a lot of these words you're gonna probably hear them out later on when you take other classes, but it's good to now know as much as you can. Okay. Now, other than those movements, we also have some special movements of those joints. We got to elevate or depress, so bring it up or down, protraction, retraction, inversion, eversion, supination, pronation. So we got some examples of those too as well. So in your book, it explains a little more. I would suggest maybe just getting down the main characteristics of each one of those three, getting a couple of those examples, and then we can apply it. Okay, so you just don't want to just memorize the joints. Now this is applying it a little more towards actual joints and movements in the body. Okay, so understand what a joint is made up of, understand kind of how it works, why it works, and then apply it a little bit to a couple of different joints. See if you can be able to practice with that. Okay, so here's elevation and depression. So temporal mandibular joints. So it's right here. Elevation, you close your mouth. Depression, can you bring it down? So my wife, and she's like all explaining me all about this. I'm like, oh, chill. Which you need to know the basics. This isn't dental school. But yeah. You got protraction and retraction. Bring it back and push it out. Class 1, class 2, skeletal problem. That's like dental stuff that she was telling me about. Like, we don't need to know all that anyways. Not yet. But yeah. Inversion, eversion. So moving it inside, moving it outside. Intertarsal joints. So each one of those has a name. Intertarsal joints. Are they going to move in or out? The ankle joints. Dorsiflexion, plantar flexion. So moving it down, moving it up. Okay. Supination and pronation. So when the palm's looking up, supine position. Supination, pronation when the palm's looking out. I did this from baseball. So a lot of times to release pressure. So going this way kind of creates a little bit. So throwing like curveballs kind of creates this tension in our shoulder and our elbows. So a lot of times they'll tell us to pronate. So move it the other way to kind of release that pressure. So that's pronation, putting it down, palm down. So that's how I remember them. So try to apply it to you. However, if you play sport or if you learn anything like that. Opposition, so kind of going against each other. Carpal, metacarpal joints. So right in between the carpals and metacarpals, there's a little joint, kind of moving it across. Okay. We also have different types of those synovial joints. So we did the types of movements. Now we just have the types of those joints. Okay. So types of joints, you can have some planar joints, some hinge joints, pivots, ellipsoid, saddle, ball and socket joints. So maybe these are more applicable to different parts of the body that you may already know. Okay. So variation in shape governs the range or how it's going to move. So depending on the shape is how that joint is going to move. Okay. So here's some examples. You see on the left, you'll see kind of like the bones, and then on the right, you'll see kind of like more of a engineering example, you can say. Okay. So if you think about plane or planar joints, letter A here on the left. So the navicular and the second. So again, they're just gonna move in that plane, just kind of glide a little bit, right? They're just gonna glide a little bit, plane joint. If you can see that little engineering example. So it's just gonna move kind of in the same spot. Okay, so 2 ways, 3 ways, wherever it goes. Hinge joints, if you've had doors, you put hinges on doors. So it's like a hinge joint. So you talk about our humerus, and you talk about our ulna, on the radius in the back. So our humerus right there, and our ulna, you have that little hinge joint where you're gonna make that kind of that movement. Okay, it's right here. Okay. Pivot joints between the head of the radius and the radia notch of the ulna. So we got our radius and our ulna, and then you're gonna just kind of like pivot. It's kind of gonna move sideways. So kind of when you move your arm, it's just gonna, they're together, so they're just gonna pivot a little bit. And you see that engineering example as well. So just one way, it's just gonna pivot kind of. Then we got the ellipsoid. Here's on our top left. Okay, so between the radius coming down from the hand or the arm and scaphoid and lunate bones on our wrists, our carpals, right? You have that little biaxial. It's just kind of like It's kind of like just enclosing a little bit, but it just moves a little bit. It's really not completely rotating or covering it completely. So they just kind of like touch each other, and there's a little bit of that a little biaxial kind of little movement across. Our biaxial over here. So that was ellipsoid. We got our saddle. So here's our saddle on the right. I know it was cut off, but that's our saddle joint. So we have that. So like kind of one on top of the other a little more. So it gives it a little opening, kind of like a saddle a little more. Between trapezium with the carpus and that metacarpal of the thumb. You can see here. So between these two right here. So once you see kind of like little grooves, so it's like sitting in there, like saddling in there, so it can move different ways. Okay, and then we have our biggest, most famous one, probably ball and socket joints. Okay, between the head of the femur and the acetabellum of that little hip bone, kind of on the bottom. So that's completely going inside. It has this big opening, and it's able to kind of to move a little more. Okay, ball and socket joints. The shoulder and hip joints. So that's also in our shoulder up here. Okay. So, wow, this is going by fast. We're almost done. So we got different factors that affect the contact and the range of motion of those joints. You have the structure of those articulating bones will affect it. The strength and the tension of those joint ligaments will affect also the range of motion. The arrangement of the muscles around it will affect the range of motion. So think about it. If you have more muscles or less muscles, how is that going to affect? If they're stronger, the ligaments are stronger or less strong, how is that going to affect? If the bones, how they're structured, right? It's not the same movement. You got bones in the wrist than bones in the shoulder. Like it's different type of movement. So that's going to affect the motion or the range of motion in those joints. Hormones as well can affect the range of motion as well. And disuse. If you don't use a joint. It tends to, I was reading that some of the liquid or the synovial fluid, some of the liquid tends to be a little thicker with the less use. So as you warm up more, you're kind of getting that liquid in movement to allow for a better joint interaction or bone to bone interaction. So that's why people warm up before they actually do big exercises. That's a purpose of warming up, to kind of warm up a little bit your bones, kind of get a little bit of rubbing in there and get that fluid kind of flowing a little bit. It doesn't just stay stationary on the spot and it starts getting thicker and thicker because it's just sitting there. It's not really moving. So use warming up is really important. Just in general, stretching. That's why I say just walk when you get older. Just walk a little bit, get your movement, stretch, different, your ankles, your knees, your hips, get everything moving. What happens when you sit there for a while, you're like, I can't get out my back. It happens to me a lot. So like just getting that movement in there was going to help you a lot. Okay, so we have what's called the different types, the selected joints of the body. Okay, so these are kind of like the main joints in the body. So we got the temporomandibular joint. So kind of memorize these at least. These are the main ones that we kind of have. This is the only movable joint in the skull. Okay, so we have it here. Anatomical components and movements. So here it is. Temporomandibular joint. Okay, TMJ. So as you can see over here on our left, here's our mandible. Here's our zygomatic process of the temporal bone. It's coming over here. Okay. Styromandibular ligament down here. Lateral ligaments, articular capsule. So we got these ligaments kind of connecting those two. So that's only like the movable joints in our skull. Okay. These are super cool. Look at the brain up here on the top. Here are our discs. Corporate process in the mandible, sagittal section. Okay. So then we have our shoulder joint. So that's ball and socket joint. Okay. So that's probably one of the biggest ones you probably know or will remember. So the ball and socket joint, you see it there moving around. The head of the humerus and the glenoid cavity, scapula up here. So here it is. So that's pretty much what I tore my labrum. I know I told you guys last class, but I tore my labrum. That's why I ended my baseball career and became a teacher. And so I'm kind of grateful that I did. Or else I would have been over there like struggling in Mexico Pro League and like trying to make money and stuff. Like I've had a better life, so I'm grateful. It sounds weird, but I'm kind of grateful that I tore my labrum. Anyways, okay. So we got we got different. So here's our shoulder joint with all these different ligaments coming around, connecting all these bones that are around there, right? So here's a little tendon of the subscapularis muscle, which we'll get into muscles next week. Here's a tendon of the biceps brachii muscle, which we'll get over here. Here's a coracohumeral ligament coming over the top. Glenohumeral ligament coming here on the inside. Transverse humeral ligament kind of coming across right here. Here's our scapula, articular capsule, subscapular bursa. So these little bursa, these little sacs that are here that are kind of protecting, so all those ligaments don't just touch each other and muscles touch each other. You got a little opening in there as well to allow for some range of motion. Subacromial, so under the acromion, bursa. Subscapular, so here's the scapula or here's the bursa. Trapezoid ligaments, conoid ligaments, clavicle on the top. Transverse humeral ligaments. Okay, so here's our shoulder joints. So here's another example. Here's our labrum. Basically, here's a labrum. So basically, for my biceps, I was throwing, extended too much. When I extend back, it like ripped. That little ligament ripped. Needed surgery, but too. So here's another good example of the shoulder. The glenoid cavity in the middle. Articular capsule coming around. Coracohumeral in the humerus ligament. More examples of that little shoulder joint. Okay. Then we have our elbow joint. So that's our hinge joint. So it's formed by the humeral trochlea and capitulum, trochlear notch of the ulna, and the head of the radius. So it's going to be in our elbow. Okay, so you got it right here. The annular ligament of the radius, here it is. Articular capsule, ulnar collateral ligament, or the UCL. Ulnar collateral ligament. Olecranon on the bottom, little bursae over here on the bottom as well. Radia collateral ligament, RCL. Here in the radius, articular capsule as well. So from all those movements hitting there, you rip those tendons or those ligaments, and after you rip those ligaments, you got to stop that range of motion. You got to put ice, stop inflammation, to kind of protect it and not let it get the hand. Tendon of biceps. So that's why we got like these strains, or sprains, like ankle sprain. They can be like class 1, class 2, class 3. How severe the ligaments in that area or the joint in that area are damaged or not. That's depending on the class you're going to get. Okay. We also have the hip joint. That's also another ball and socket joint. Okay, so the head of the femur at the acetabellum of the hip. We have a pubofemoral ligament. Okay, pubis femur ligament. Iliofemoral ligament connecting the ilium and the femur. Okay. Obturator membrane, the little hole in there. Obturator canal. Remember, our hip bone. Okay. Rectus femoris muscle coming from the top. So we have a little tendon right here connecting that muscle to the bone. Okay, the hip bone. Ischiofemoris, so the ischium and the femur. So the words, again, the names themselves will tell you where they are as well. Okay, and then we have the knee joint formed by the femoral and tibial condyles and the patella. So here's our knee. Okay, here's our ACL, kind of in the middle. PCL as well, coming up on the middle, inside. Lateral meniscus, fibular collateral ligament, so FCL. And medial condyle of that femur, medial meniscus coming in here in the middle. Tibial collateral ligament, TCL, kind of from the outside. Again, here's the anterior cruciate, posterior cruciate, PCL, ACL. Transfer ligament of the knee, patellotibial ligament, tibial collateral ligament. What else do we have? We got these tendons coming out. See how it's connecting that knee? See how we got a little bit of cushion in there. Meniscus right here, lateral meniscus, medial meniscus, kind of protecting, give it a little bit of cushion, allow for shock absorption, things like that. Okay. Here's our patella. So here's looking at the front. Here's our patella. lateral patellar retinaculum, fibular collateral ligament, tibia, fibular, tibia, tibia, fibula, medial patellar retinaculum. We got our muscles, vastus medialis, a little bursae also, or bursa in between the bone and our muscles in here, getting a little bit of protection in there. Okay, and then we have our ankle joint. So formed by the articulations among the lateral and medial malleoli and the talus. So here we look at it. Calcaneus all the way at the bottom. Here's our little talus. On top of the calcaneus. Calcaneal tendon coming up. Their tibia. MCL medial collateral ligament here in our ankle. Okay, posterior, so it's split into different parts. Tibial calcanea, tibial navicular, depending where it connects to. Calcaneus, the navicular, anterior tibial talar to the talus ligaments. Okay, so depending where it connects to is going to be the name itself as well. Here's our tibia and all these ligaments connecting to the bottom bones. So I know in the skeletal system we just looked a lot of bones together, but they're not just there together. We got all these tendons connecting them, allow us for movement, things like that. So when someone has an ankle sprain, one of these are damaged, right? It's an ankle sprain. One of these is damaged, extended too much. So depending how severe the damage is, if it's going to be inflammation or not, got some blood vessels around it as well. So that's how I'll take care of it. So here's another, now looking at the lateral view. And lastly, arthroplasty. So that's kind of looking at or replacing a lot of those bones in there in the joints. Okay, so here's an artificial hip joint before they implanted, so put it right at the spots. Total knee replacements as well, femoral component, tibial component. So we have to somehow plastic spacers right here as well in the tibial, femoral component, patellar component. So that's this whole knee is replaced, different sections. Maybe all of that was damaged, and you try to get again, make that same range of motion, make it nice and safe, nice and cushioned. So we can move if anyone gets some type of joint injury. So I think, yep, that was it. All right, so study for your test, and good luck, and I'll see you next week.